Excited to introduce our speaker for today. We've got with us our lovely Claire Edmonds. So some of you might be familiar with Claire if you have been in one of her programs, but Claire is a registered psychotherapist and holds a doctorate in psychology from York University. She has worked exclusively in oncology for over 30 years with both patients and caregivers at the Princess Margaret Cancer Centre. She was a member of the research team that developed the Healing Journey program, a coping skills course for patients and caregivers, and she now works in the community predominantly at Wellspring Cancer Support Centres across Canada, as well as in other nonprofit cancer organizations. So I'm very pleased to pass the mic over to you, Claire, for our presentation for today.
Thank you very much, Vanessa. That was a lovely introduction. I'm just delighted to be here with you all today. On this very odd day in Toronto, we've got snow and they're sitting on top of my tulips, but maybe they'll reinvent themselves as they go along. So we're here to talk about resilience and/or reinvention. And as I come to this topic, it is of great personal interest to me. I come to this discussion today with one of my feet in the world of psycho-oncology. That's the practice of psychotherapy in the world of oncology. But I also have another foot in the world of the patient. I have had two different kinds of cancer. 6 years ago, I coped with breast cancer. And I had what is euphemistically referred to as a complex recovery, meaning lots of things happened that were difficult. And then the second cancer I developed kind of out of the blue and unrelated was a very rare form of eye cancer. That was about 2.5 years ago. And so when I come to the question of resilience and reinvention, a big part of it is that part of me that has experienced this personally. And so it's a powerful subject for me. And I actually could have entitled this presentation A Contrarian's View of Resilience, in that resilience is a popular word now, particularly because I think of COVID, but it's a word that I think gets misused. So here we are. Here is a definition that I literally swiped off the internet. Is looking at the sort of classic definition of what resilience means. The capacity to recover quickly from difficulties, toughness, the often remarkable resilience of so many British institutions. Or the second one, the ability of a substance or object to spring back into shape, elasticity. Nylon is excellent in wearability and resilience. And what I find interesting about both of those definitions is they don't really refer to human beings. They're referring to institutions or objects. And I think that that's an appropriate use of the word resilience. I think that when it comes to cancer, resilience might be a bit of a misnomer. Next slide, please. So resilience reflects a shift in focus for psychology. Psychology traditionally has been focused on things when they don't go well, when they don't go right, when people need help and support in managing the stressors of life. When our discussion of resilience in the field, I think, represents a shift in focus, looking at the emotional robustness in the face of adversity. It's kind of reflected in the shift, I think, from studying post-traumatic stress disorder, which is a very natural and understandable response to profound stressors, to understanding post-traumatic growth, a term that I really like. It's a concept that supports patients in moving out beyond the healthcare circle back into their own lives. You're so resilient, you can go back and live your life as you once did prior to your diagnosis. I worked with one, very briefly, worked with one person who said, cancer was just a blip in my life. It came and it went. It's gone. I don't think about it. Next slide, please. But I think the big question is, when do we return to normal? We euphemistically term the new normal as something that is what we discover when we return back to a busy life after having had cancer. What I think of this new normal as is learning to live with the consequences of cancer. I think those consequences can be really profound, and they're not just physical, although the physical ramifications of cancer treatment and cancer itself can be profound. It's also emotional. What matters to me now? What's my life about? And it can be social as well. You know, how do I want to spend my time? Who do I want to spend my time with? I love the term side effects, because in my experience, side effects aren't something that we live with beside us. We don't live beside them. We kind of have to live around them. Side effects are sometimes quite central in one's life. And when we use the term side effect, I think we're suggesting it's just an add-on, an addition, not such a hassle, but for many people, it's profound. We also, in this new normal, need to learn to live with surveillance, sometimes medical surveillance, and seeing our medical team every 3-6 months, every year, having various tests and surveillance methods in order to see how we are doing, to monitor our health, but also to see if the cancer's returned. Some of that vigilance is personal. Am I feeling an ache or a pain? What might that be? Oh gosh, is that a lump or a bump? Is this surveillance of watching our bodies in a new way, because we've known that we've had cancer once and it can happen again. I think of this difference, the new normal versus the normal that we've come from. I think of this as the difference between BC, before cancer, and AD, after diagnosis. And in my experience, those two lives are really, really quite different. Next slide, please, Barb. We talk about cancer as if it's a single event. We talk about cancer as if it's in a box. Yes, I've had cancer. But anybody who's been in that box knows that there's an awful lot more happening. It's not a single event. It's a multiple series of events, some of them traumatic, some of them not, but all of them adding up to this big event in our lives. Some people come to the diagnosis of cancer with as a surprise. I would say that both of my diagnoses, one of them came through routine screening, but the other one was a complete surprise. There was no indication that this might happen. And so sometimes we expect that something might be happening. If we have symptoms and we're undergoing investigations, sometimes it's surprise, like it's a routine screening. However that occurred for you, I know that you remember it well. You also remember receiving the diagnosis. Those are moments that are imprinted profoundly on our minds. It is really opening a portal between the BC and the AD. Many of us at that moment realized life is going to be different. And most of us remember the way we were told, the words that were used, and the impact that it had on us and on the people that we loved or love. There's more testing, which now takes on a new meaning, because you know that they are untangling the secrets of what this disease is in your case. More testing, some of it unpleasant, some of it painful, most of it scary. Then we receive a treatment plan, and the treatment plan can be involved and complex, or it may be more simple. But however the treatment plan is created for you, it's a lot to absorb. There can be surgery. There can be surgeries. It can be multiple. Some people have radiation. Some people have chemotherapy. Many people have both. There can be ongoing medication like anti-hormonal medications, tamoxifen, aromatase inhibitors, or other ongoing chemotherapies. There's ongoing testing. How are you responding to the treatment that you're receiving? How are your blood counts? How is the disease responding to the treatment? And there are changes in the body and how it functions. Whatever happens with any of these treatments, the body is changed, sometimes in the short run, often in the long run. I remember very clearly being asked to look at my scars after I had reconstruction surgery and mastectomy. And I can remember being very frightened to look down and see all the scars. And when I finally did, with the help of a really kind nurse, I remember thinking, oh my Lord, I look like a woman who has been a magician's assistant and in the box that gets sawed in half, and that something terrible went wrong because I had this big scar across. I had all kinds of changes in my body. And I can say now that while I am used to the look and feel of my body, there are still many things that I can't do. Like in yoga, there's certain stretches there's just not enough skin available for me to do that. And so these changes in how the body functions and how it feels can really affect our body integrity. This container that I've been living in for so many years has now changed. What is that like? And then coming back again to vigilance, ever and ongoing, both at a personal level and at a medical level. Okay, Barb, next slide, please. So we tend to see what we want to see. And I pulled these off the internet. Gosh, there are a lot of logos and perspectives on cancer, aren't there? Bravely fighting cancer. Go, fight, win. Give me the courage to fight and the strength to win. Kicked cancer's ass. These are all sort of indicators of a perspective that society has about cancer, that it's a battle, that it's something to be won, that it's something to be fought. I like the blank out sign over the bravely fighting cancer, because I think that sometimes it feels like we're feeling brave and other times we don't feel so brave. We want to be open to all possibilities. I was asked to be part of a campaign for breast cancer, since it was about 5 years ago. And it was they asked me to take a pose, one of defiance and strength. And I look at this now and I see so much more happening. Can we see the next slide, please? This is a picture that they took. I said I wouldn't do it if it had pink ribbons. Fortunately, no pink ribbons, but lots of pink dust. So we did have a little bit of fun with the pink dust. I was asked to cross my arms and steel my hips and shoulders and to look into the camera. And when I look at that picture, I can see the strength of my body, because it is a strong body. It's come through a lot. It's a powerful body. But when I look into the face, I see the uncertainty. I see that sense of feeling a bit lost. I see the rest of the story. And so there is resilience on the outside, I think. But on the inside, other things are going on for me. It is not all as it seems. Next slide, please. So I want to offer an alternative perspective to resilience. It may be less about returning to normal or being brave, and much more about learning about ourselves and learning about life. We have to assimilate. That means to take in and accommodate, to, in essence, find a shelf inside of ourselves to put this experience and to understand this experience. The questions that come to mind are, what happened to me? One day I was well, and the next day I wasn't. How do I feel? What's changed in me? And what's remained the same? What are my strengths? What are my vulnerabilities? What helps me and what doesn't? What matters to me now and what can I let go of? And then the ultimate question for me is, knowing what I know now after having had cancer, how do I want to live my life? To me, these are questions that lead to healing. And healing in the profoundest sense means to make whole again. Perhaps whole in a different way, but whole none the same, just the same. It's an opportunity to learn from pain and fear. What do those experiences have to teach us? To learn from this interface between life and death. I remember learning so much from the small kindnesses along the way, the humbleness and humanity of this experience, putting our lives into the hands of others. What does this teach us? Next slide, please. And so it brings us to grief, which may be a big part of life that we don't really address as grief. Grief is really change. Grief, we feel grief when things change in a way that we don't want them to. It can be a huge grief like cancer or bereavement, or it can be a small grief like, I think my garden got kind of beaten up last night by the snow. I'm wondering what will survive. So we experience grief throughout our lives in big ways and little ways. And it's so much more than just bereavement. It's not about, it's about accepting a change or receiving a change that we may not want to embrace, but a reality that we don't have a choice about. It's accepting a hard reality that we don't want. And it is emotional work, and it changes us. In fact, it's hard emotional work. And I would go on to say it can't be forced or grasped. It is a process that we must allow, and it can only be encouraged, nurtured. Next slide, please. So some of you who've worked with me before will recognize these tasks of grief, and I give all credit to William Warden, who is a grief therapist and theorist, who has developed some of these ideas. We're using a different language for them, but I think that we are leaning heavily into the grief literature. So the difficult realities, what are they? Well, cancer is something nobody wants, and in fact, most of us fear. When we first receive that diagnosis, we often feel numb. That numbness is, in fact, our struggle to accept and to hear those words and to take them in fully. And as I spoke earlier, cancer presents a whole herd of unwanted realities. Surgery, chemo, hair loss, body changes, the effects of radiation, telling my family, managing my friends and relationships, work, all the different things, aspects of our lives that cancer ricochets through. So I think that this is a particularly apt model for cancer because we are always working with some new reality that we have to somehow grasp and understand. So how do we do that? How does that happen? Well, task 1 takes us very handily to task 2. Next slide, please. So task 2 is the work, and it is work, to feel the feelings and to think the thoughts and to allow that to come into our awareness. There are so many feelings that go with a diagnosis of cancer. Of course, there's fear, sadness, anger, loss, feelings of being alone, worried, confused, scared, terrified, hopeful. I'm sure in your own experience, you're going to be able to identify ones that aren't here. Identifying and acknowledging these thoughts and feelings is a really important step in healing. We know that by labeling a feeling, we already have a handle on it. So when we have moments of feeling overwhelmed, if I can say, okay, this is overwhelmed, what is the feeling underneath that? Okay, I'm scared. This is what fear feels like. I'm already acknowledging that. Labeling and understanding our feelings is really important in this process. I think of it as honoring the feelings, not sweeping them aside, not pushing them away. For me, I had beside me through my cancer experiences journals, and I wrote. Oh my gosh, I wrote. I didn't write for anyone else but me. And I wrote in order to explore and investigate the feelings that I was having, and then to take them into the thoughts that I was having. What am I fearful about? I'm worried about that test. What about that test am I worried about? I'm worried it's going to hurt. Okay, what can you do about that? Well, I can ask, and I can ask for support as I go through it. So I found that my journal was a place to acknowledge and honor these feelings and experiences. And by laying them to rest there, I had more space in my heart and in my mind to be present with reality. So task 1 and task 2 are entwined. Task 1 and task 2 need each other. May I have the next slide, please? So in order to accept a difficult reality, I have to acknowledge the feelings. And when I'm having a lot of feelings, I need to look deeper for what I'm having a hard time accepting. This is dynamic. It's never the same every day. It can happen anytime. Some of these realities are not necessarily accepted permanently. I can still wake up in the morning and go, oh my gosh, look at everything I've been through. Sometimes in the evening, when my eyesight is less acute, I think, oh, right, damn, I've had cancer. Lots of events in life can re-trigger our need for acknowledgement and acceptance. There can be moments where we're humming along in life quite happily, and then something triggers our understanding of how we've been changed. It could be hanging out with old friends. It could be taking on an old hobby. I used to be an avid reader. I've now become an avid listener, in that I listen to talking books because it's just easier for me. This process of acknowledgement and acceptance is never passive. It's highly active and very demanding. And if people are feeling tired, this is often the reason. They're processing so much in their hearts and in their minds. And if we get stuck in acceptance and acknowledgement, if we find we are spinning there, it can be really helpful to have somebody else to talk to, a professional who understands these ideas of the profound effect that the experience of cancer can have. I think of it as being witnessed and helping someone guide us through our feelings. Should you want to see a psychotherapist, I do think it's important to see someone who has experience with cancer. Because the idea of psycho-oncology is that there are differences between accepting some realities and learning to live with cancer. That reality requires some expertise to understand. There are lots of people who do this kind of work. And in fact, most hospitals have a psychosocial department where they have social workers, psychologists, psychotherapists, and psychiatrists who can help us work through the acceptance and the emotional acknowledgement. Next slide, please. Now the third task, and again, tasks require active engagement. They're hard work. The next one is adaptation, and that is when we're ready, we can shift to a position of, okay, given this reality, what can I do to adapt? Given this reality, how can I help myself? All of you are members of Wellspring. You have already asked yourself these questions, and you found Wellspring in that process. So we want to learn coping skills, strategies for self-care, what kind of changes we want to make in our lives. We learn how to live with all the changes that cancer has brought to our lives. Wellspring is all about adapting, but it's also about acceptance and acknowledgement, because when we are adapting, we can fall back into a place of, oh crap, this is how I feel about having cancer. The healing journey in particular epitomizes this process of learning coping skills. And having been involved with the healing journey since I was about 24, excuse me, I can say that I use those coping skills every single day, which doesn't mean I didn't have lots of thoughts and feelings to acknowledge and was challenged in grasping some of my new realities. Next slide, please. Excuse me. So reinvention, it's another task. It's on the list. And I think that it's where we go as we heal. Knowing what I know now, how do I choose to live my life? That the knowing is that I've accepted this difficult reality. I recognize and understand the feelings that are a part of that process. I have learned how to adapt. I've learned so much. Now, how do I want to live my life? Such important questions. What matters to me now? There can be some profound changes in that sense of what matters to me now. And what doesn't matter to me? What can I let go of? That's a very freeing question. What have I learned about myself and about life? And what can I do with that knowledge? What can I do with my new understandings? And I think when we want to sort of a poster child for reinvention, I have to say that our Wellspring volunteers are the essence of it. They have gone through their experience, they have learned from it, they have struggled with it, and they have come to a position that, knowing what I know now, I want to help other people. And in fact, I believe it's Volunteers Week. This week is a week in which we salute our volunteers. And so I'm giving a big shout out to all the people at Wellspring who serve as volunteers. That's really feeding it forward. And often if we feel like, in particular, an important reinvention can be, if there were things that we needed and couldn't find when we were coping with cancer, some of the reinventions that take place are, how can I offer what I needed to the world? And I think that's where great changes occur. And I would say that that was actually how Wellspring itself was birthed. Next slide, please. And so here we go. What's the difference between resiliency and reinvention? Well, huge, I think. Resiliency for me doesn't reflect the hard work that reinvention requires. Reinvention is very active, it requires energy and focus. While resilience is something that we know less about. It's something that sometimes we think we either have or we don't have. I think the other problem with the term resiliency is it sets up the expectation that we'll return to some sort of normal, that the old normal will come back. Just as elastic is resilient, I stretch it and it comes back into shape. That's what makes it elastic. I just don't think that works for human beings. I don't think that normal is always where we want to end. I think sometimes we want to end up changed because that's part of our growth. I think that resiliency can fail us in the long run when difficult realities start to pile up and our energy flags. I think that, in fact, resiliency can quit. My own feeling was there were times when the feelings I was experiencing, I was worn down, I was tired of pretending to be brave. I was tired of pretending to be independent. I was tired of yet more challenges. I felt depleted. I felt eroded was one of the words that I used. I felt like I was eroding under the pressures that I was experiencing. And so when energy flags, it's very hard to bring resiliency to the picture. And in fact, I think to some extent, at least for me, resilience was performative. I performed it for other people. I performed it for some of my physicians, and I performed it for some of my friends. How are you? I'm fine, thanks, doing great. I'm doing okay. Considering everything, I'm fine. That wasn't how I was necessarily feeling. And as I became more tired and more worn down, the honesty increased. What I love about reinvention is it's humane. It allows for these times of depletion, erosion, and anger and fear. It allows for and values the expression of feelings, remembering that those feelings are in service of accepting difficult realities. The feelings aren't random. They are actually purposeful. Acknowledging those feelings helps us. Task 1 to task 2, task 2 to task 1. And this idea of valuing expression allows us to sink into authenticity, to be honest, to become more clearly who we are, both in our strengths and in our vulnerabilities. Next slide, please. I am fascinated by reinvention. I look for it in literature. I look for it in poetry, and I look for it in COVID. This was an article that was in the New York Times fairly recently. I think it was Monday, April 5th or that weekend. I'll give you the reference for it. In which a group of journalists and photographers interviewed people about what COVID had taught them. So people have found themselves close to life's deepest questions, those forced by an apocalypse, being COVID. Questions about how we live, how we suffer, and how we make meaning of our short time here on Earth. Who am I? Who are we? Who are we becoming? How have we been changed? Doesn't that sound like the cancer experience? Just a little. I was very intrigued by that. Next slide, please. So this is a list of quotes from people who they interviewed. And I want us to just take a moment to pause and to think about what kind of reinvention that we're hearing here. So this woman, Erin, says, my husband quit his job and we moved to his hometown. No one yells every day anymore. And I've come to the realization that maybe I deserve to be happy too. Can we hear all that's gone on in that story? It's just a couple of sentences, but in there, what I'm hearing is a reinvention of relationship, a redirection of life, and new awareness is emerging about valuing ourselves. Next person said, I applied to over 400 jobs in 2020 alone. It feels like there's no catching up, let alone getting ahead. I focus on enjoying the little things because those are the things I can control. Isn't that interesting? How many of us have shifted our lives to living what I call the macro life? You've heard of macro photography. Macro photography is where artists take pictures very, very, very close up, often of leaves, petals, of flowers, of nature. And this very close-up perspective allows us to see the intricate beauty of a single leaf with a dewdrop, or the beauty of a snowflake. It's this idea that these little things can become so profoundly beautiful and take us into the moment. I think of a simple cup of tea. I know it's just a simple cup of tea, but it's so beautiful, and I'm so grateful to have it. Next person says, the pandemic has forced me into the present. It's the meditation I never wanted to have, but have come to appreciate it. That being said, last week I kicked a hole in the bathroom door. I love that quote. I love the quote because of its humanity. This is somebody who's definitely working towards task 3 and then has moments of going back to task 2 and task 1, because this is not necessarily a straight line. It's not like we arrive at reinvention and we're done. No, we go back to having strong feelings like kicking in the door because we're so frustrated. And we have to look at that. It gives us another opportunity to go through that process of understanding our feelings as we move towards coping. And she's found that meditation and being in the present is a good coping strategy for her. And occasionally it fails her. Next slide, please. I made a vow not to skip another Christmas or Japanese New Year with my parents. I don't know how many I'll have left with them. I think that's one of the things that certainly my cancer experience has given me, is a sense of I don't want to miss a moment with the people I love. And I say, I love you so much more than I ever did. I don't think I get off the phone without saying, I love you just because it feels good to say it. And I come from a family that doesn't do that easily. I just couldn't deal with the lack of empathy. Now I have very few people who survived on my list of friends, and my phone is a whole lot quieter. But honestly, I wouldn't have it any other way. So there's another example of how the friends that stay with us through this experience become valued in a new and deeper way. And in some ways, other people fall off our list of friends, people who can't cope or people who are uncomfortable. And I think many of us have said, I gained some friends and I lost some friends. And I think that's part of reinvention too, because we are changed. This is a lovely one too. I don't skip walks with my husband just because I'm tired. And suddenly, new things take on deeper meaning, deeper pleasures. Here's someone who's putting it right out there. I know I'm becoming someone different. That's the process of reinvention. Next slide, please. I hope there are not too many of these. I just found them really spoke to me, so I'm sharing them. I'm not going to try to be polite anymore. I am going to hopefully become a less behaved, less likable, ballsier, more outspoken, more dangerous woman. All these rules I have followed, these rules will not save me. Wow, that's an interesting reinvention. And I think I'm hearing in there, are you hearing it too? Authenticity. Yeah, she's becoming more authentic. She's not going to just take things that don't feel right to her. She's going to stand up for what she believes in. That would be a very interesting reinvention to be present for. I really feel like I learned a lot during the pandemic, but this new feeling has this real feeling of emptiness I've never felt before. And I think that can be part of this whole experience as well. That can be part of the feelings that we sometimes have to allow ourselves to feel and acknowledge, is that there is an aloneness at times. There is a sense of, well, it's the existential angst. I think COVID has brought that into many people's awareness, and I certainly know cancer includes a certain existential experience attached to it too. Next slide, please. Just a few more. I no longer have any clear trajectory, and I'm learning to make peace with that. Isn't that delightful? That is so much like the words I hear people with cancer saying. That is so much a sentiment that I hear in my work, that I now know that life is variable, that it can change on a dime, and I'm learning to make peace with that. I broke up with my boyfriend of nearly 4 years, and I'm trying to take it one day at a time, but I'm also still feeling lost because I don't have an after to find. Again, that sense of in progress, in process. This is somebody who's still under construction, still trying to figure it out, but she's already made some profound changes. Coming out of this, I realized emotions can't wait for another day. I am calling my parents more and expressing my love and gratitude to them. Isn't that terrific? And I hope she's also recognizing that her own feelings matter very much too. Feelings of less attractive feelings, not just love and gratitude, but also anger and frustration. They're just as real. Next slide, please. So this is the article. Our before no longer makes sense, and how do we live now? And I know that's a huge mouthful there, but maybe it's something that Wellspring can put up, or you can find on this web talk. The last one, the last quote, which I really thought was lovely. I am falling back in love with myself, taking extra time each day to take care of my African violets and my orchids. I plan to live my life moving forward, no more doing for others what I don't want to do. I am centering my life on the things that give me peace. Now that's reinvention. And it's a kind of reinvention that I personally have found very gratifying. For me now, the experience of peace really matters. And I'm not trying to be brave, and I'm not trying to be resilient. I'm trying to be authentic and honest and do the things that feel right for me. Next slide, please. And there I am, being authentically myself, doing something that gives me great peace and pleasure, playing the guitar and enjoying the poetry of music. So that's what I have to say about authenticity and resilience and reinvention. And I'm wondering how it fits for everybody here.
Perfect. Thank you so much, Claire.
No
Just
problem.
wanted to, I saw there was a chat in the message with the article that you had sent, so I'm just going to copy and paste that as well. So one of our members kindly shared that in the chat, so I'm just going to put that out there so it's easily accessible to everyone, so they don't have to search it up. And in the meantime, I just wanted to say thank you so much for your gentle, informative, and just taking the time to really share your personal story and your lessons and sharing these thoughts for us, Claire.
Oh, you're very welcome. I'm part of the community in more than one way. I feel very at home with the members of Wellspring because we recognize each other's stories.
So just to thank you again, and I think I'm just gonna jump into our question period. So there's a question on for individuals who are going through their cancer journey, but are struggling with finding the answers to questions such as what is important to me now, what can I let go of? Do you have any suggestions that might help people that are struggling to come to terms with the answers to these questions?
Those are such big questions. I do know that it can't be forced and that it is a process. I'll share another personal story. After Cancer 1 and before Cancer 2, I took up running as a healthy activity as part of a rehab program. And I was pushing because I thought I had to push because I needed to get well quick because that's what I thought what healing was. And I ran around the block and I tripped and I landed smack on my face and picked myself up and came home wounded and battered. And I said to myself, oh, Claire, you're such an idiot. What are you trying to do? Kill yourself out there? And then I realized that I was trying to force something to happen that was going to happen or not on its own time. I began to realize that healing isn't something that I can clamber after, grab and force down to the ground and make it mine. Healing, in fact, is more like trying to get a butterfly to land on your hand. It requires thoughtfulness, peacefulness, support. It requires patience. And so these really big questions about what do I want to let go of, I think that we can begin to use imagery is one way. What would be a perfect day? What would my idea of a perfect day be? For me, all sorts of things come to mind. But if I'm going to have a perfect day, it means I've got to let go of a bunch of things too, right? I can't do 15 groups in a day and play the guitar and do sewing and quilting and drawing and all the things I enjoy doing. I have to give something up. And so I need to find a balance. And attached to that too, I think also is the sense that we can also, since I think cancer does bring us nose to nose with the issues of longevity and survival, that we can reach into that rather than being scared by it. We can reach in and we can ask. If I say, for example, had 1 week left to live, what would I do with it? How would I experience it? What would I want to do? Who would I want to be with? And who wouldn't I want to be with? And what would I not want to do? Very interestingly, I think out of the thousands of people I've done that exercise with, only one person ever said that they'd go back to work. That tells us something. So perhaps I want to make some modifications with work. So that's the way I kind of come to that question about what do I want to keep and what do I want to let go of. That if we allow ourselves the time to be thoughtful, to journal, to have quiet time, and to not force it, some of these things will bubble to the surface. And using imagery such as one day left, or one day, perfect day, or a even harder one, a perfect week, or my last week. These are the kinds of exercises that can give us some awareness. I hope that's helpful.
Thank you for that, Claire. So our next question, I'm getting a lot of comments saying that people do resonate with the quotes that you shared. So thank you for sharing those ones. And I have a comment here that says that some people are struggling right now, and there is a fear that the reinvention stage might never take place, or questions on when can they expect reinvention to occur in their journey. Do you have any words to say about that?
That's a big one. And I'm first of all, I'm delighted that the quotes go beyond COVID, because I did feel this great resonation with them. I'm glad some of you felt that too. Will reinvention happen? I think reinvention happens when we're mindful about what's happening to us. If we allow ourselves to experience it, not numb out, not deny it, or walk away from it. It gives us an opportunity to grow through it. I think COVID is a really good example. And I know the news on Friday with the next phase of lockdown hit people very hard. I've seen it in my private practice. I've seen it and heard about it from lots of people in my life, safely on the phone and through Zoom. That this sort of next phase of lockdown begins to feel hopeless. And I think what we have to do is notice that and say, it's okay. It's okay that it feels hopeless. That in this moment, I feel kind of hopeless about this. That's acknowledging the reality of, I don't want to have another shutdown, but I'm in another shutdown. And so that feeling of anger and frustration is very much part of the experience. And in time, after we've acknowledged that, we can move into the adaptations. Like, the weather's going to get warmer. I can spend more time outside. I can go to the playgrounds as a new change. I can go into the parks. I can walk the streets. I can take deep breaths. The snow is going to melt. It's going to be a warmer weekend. These are small reinventions of life. In fact, I think one of the reinventions I'm hearing is a lot of people are appreciating outdoors like they never have before. And in terms of the cancer experience, reinvention tends to happen when we are mindful. And the very fact that you are here as part of Wellspring, the very fact that you chose to listen to this time together that we have, suggests an openness to these ideas, suggests an openness. So one of the things that you can do is do some journaling, do some exploration, knowing too that you can go towards reinvention and then find yourself back and feeling the feelings and thinking the thoughts, to adapting back to task one if I don't want to. I remember the whole exercise thing, knowing that then my new reality is exercise is important for the kinds of cancers that I've had. And my thoughts and feelings, I don't really like exercise. So I got some thoughts and feelings about that, but I moved on and I found ways to do it. But there's some mornings I get up and I think, oh, I have to exercise. It's still part of it. It's just part of it. So I hope that's helpful.
Thank you for that, Claire. So Claire, I'm just seeing like an influx of comments saying how people have found this webinar to be something that really resonates with them and just makes them feel like they're really able to relate and connect with everything that you did say. And so many messages of thanks. So I'm going to try to gather those messages for you, so we can take a look at that afterwards. But I just wanted to jump to the next question. How can you be resilient when there is a constant fear of recurrence?
Well, Yeah, no kidding, eh? What an excellent question. I agree with you. I'm not sure resilience is possible when we are under the constant threat of cancer, and not just recurrence, but testing and seeing more doctors. I can't even begin to say how many physicians I have in my life. I'm grateful for all of them, but I don't particularly enjoy visiting them. So it is a question, I think, of, given that you know that recurrence is possible, what becomes important to you now? How does that inform you in how you want to live your life? Um, for me, it has something to do with feeling, feeling life as clearly as I can. So things like gardening, I want to, I want to feel the earth. I want to smell it. I find the senses to fill my experience so that I'm not doing things on automatic pilot. I don't want to be living my life in a blur of automatic pilot. I want to be living my life acutely connected to what I'm doing. So cooking, for example, to appreciate the beauty of the food that I'm working with, the blessing of having food to create. There's a lovely author, Thich Nhat Hanh, who is a Buddhist monk who lived, I think he's gone now, but he lived in Plum Village. And he describes the beauty of small entropic busyness. Entropy is this idea that everything winds down. So I can do my dishes, I can do my laundry, but you know what? There's going to be more tomorrow. It's never a done deal. And so rather than fetching about that or whining about that, embrace that. Can I fold the laundry and appreciate that it's clean, that I can push the wrinkles away, that I can feel the cloth in my hands? Can I appreciate the meal that was on the dish and wash it and feel it becoming smooth and clean? I know it sounds kind of silly, but when we get into this kind of mindfulness state, everything is more acute, more real, brighter, clearer. And I think that that's where we find the remedy to the fear of recurrence, because recurrence is in the future or not. And I can spend an awful lot of energy worrying about something that may or may not happen, that will take me away from this moment that I'm certain I have. At least this moment I know. I got it. It's in my hands. I don't want it to slip through my fingers. I don't know whether that's any help or whether that feels like too great a reach. But for me, that's where I have found comfort. There you go. And Thich Nhat Hanh is still living. Thank you, Heather. He's 94. Still doing dishes, no doubt. He's got a whole series of books. They're very slim volumes, and they're quite beautiful.
Thank you, Claire. So I think our next question, so I know you articulated the tension between society's expectation for members undergoing the cancer experience to be brave and coping, but the realities of the journey and how difficult it is. So there's a question on what in your experience helps navigate this, having to try to act fine, but really struggling. Are there any suggestions that you might have for people?
Yes, I choose my audience. I choose my audience. There are friends that I have that I can really tell them how I'm doing, and they want to know, and I feel really comfortable telling them because I also reciprocate. I listen to how they're doing. Honesty is really important in those relationships. Further out in my social spheres are people that I feel less connected to and with whom deep honesty is less important. And so I may make a decision about whether I've got aches and pains today. Do I want to share that with this person? Maybe, maybe not. It's my choice. It's my story. So we do have some choices. I think sometimes it's hard to be deeply honest with the people we live with because they love us. So for instance, if my mom asks me how I am, how's your vision? I'll probably say, not too bad. It was miserable last night, not too bad. I probably wouldn't tell her that I had a hard time last night with it, because I don't think it helps her, and I don't want her to worry. But then there are other people that will ask, and I'll be really upfront with them. But I try to do it in a way that is compassionate. And sometimes I really appreciate when people ask and they mean it. Because sometimes they say, "Hey, how are you?" And I know they don't mean it. And other people say, "Hey, how are you?" And that can lead to some really beautiful conversations. So I think we've got some choice about who we are deeply authentic with. Um, and it comes down to your comfort level. And sometimes we can train people around us to accept the authenticity too. I have done that with friends. You know, how are you doing? Well, you really want to know? Because I can tell you. But and that opens up a new level of honesty. So it's a work in progress, and maybe some of that reinvention falls out in our social circles as well. Maybe they go through a little reinvention with us. I'm not sure.
Thank you, Claire. So our next question, for members who are living with cancer for which there is no cure or are
Yes.
really worried about not being around maybe in the future,
Yes.
is there a way that you can suggest to kind of deal with that, or to make decisions about future things that might occur if it's taking away joy from the present?
Mhm. I think that support can be really, really important here, to try to live in the moment with what we have. I mean, frankly, anybody who's had or has cancer knows that life life is fragile and it's not a guarantee. And that's an invitation into the moment, and an invitation to get support. So to acknowledge those thoughts and those feelings, I think it's really important to have someone who can witness them with you, to acknowledge them with you, who can validate you in your experience, because not many people want to hear about it, but support groups do, therapists do. They have large shoulders, they can hear it all. And then deciding again what really matters to me it's a fundamental question. Spending time with people I love, or worrying about the future. Can I bring myself into this moment? There is training and meditation that can help with that. Finding things that, if joy is a challenge, we want to look at what is standing in the way between you and the moment that you can let yourself feel it. If joy isn't present, we would want to look at the feelings that are getting in the way of joy, because maybe if they're acknowledged, there'll be more space. That's the great thing about feelings. I think of feelings as a little bit like a 3-year-old. I know it's funny, but a 3-year-old will pull on your shirt. Mommy, 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 mommy. They're so persistent. They're so persistent until you turn and say, "Yes, I'm listening. What's going on for you?" And then you have a conversation and you hear it and they calm down. Feelings are the same way. They will nag at us until we take the time to say, "Whoa, okay, what is it? What am I feeling?" And acknowledge them by writing them or speaking your truth to somebody. And when we do that, we get little cracks of space that allow us to let joy enter. It may be very subtle, but I'm hoping that through that process, you may be able to find some peace and find some joy. Lots of programs at Wellspring can help you do that. The healing journey certainly is pretty much all about that in the long run. And meditation, art therapy, drumming, all kinds of things can help us find that through expression of emotion and that release. It's hard to, if we're stomping down feelings, trying to keep ourselves from expressing them or experiencing them, it's an all over kind of pushing down. We don't just push down the bad feelings. We also push down other feelings. It's not, it doesn't discriminate. It pushes everything down, and it pushes joy down too. So when we start to allow ourselves to feel, we give ourselves an opportunity, perhaps, to experience some joy.
Thank you so much, Claire. So I think that about wraps up. I think we're about at 1 o'clock already. So I just wanted to say, Claire, thank you so, so much. I've gotten so many messages of just genuine appreciation and thankfulness for you and for your time and sharing your thoughts and your experience. So just a huge, huge thank you from everyone at Wellspring for your presentation today and just for how you deliver it, just the way you carry yourself and speak about your experiences. Just a huge thank you for you. And I know a lot of people, I've been getting a lot of messages about just to pass along those messages to you. So I'm just hoping that even saying this can get a little bit, make all of those positive feelings. I'm just sharing them your way. So just a huge thank you again. And I think we will wrap up because I think we are out of time, but I'm going to connect with you, Claire, about your presentation. I know there were a couple of people who were wanting to have the slides to see if they can kind of reflect on them afterwards as well. Okay, yes. Awesome. So I will send those out afterwards as well, because I know having that to look upon and reflect on will be super helpful for people. And if you wanted Claire's audio as well, once we do get that recording up on the web, then you'll be able to kind of have both pieces for the entire presentation. So I think with that, we will wrap up for today. And just a huge thank you to everyone again for taking the time to join us today.
Yes.
And so Claire, if you have any final words.
Just be well, take good care of yourself, deep breaths. I hope that you can enjoy some warm weather on the weekend. And thank you for being here. I do feel your presence as a group, and that feels like coming home. Thank you.
Thank you, everyone. I hope everyone enjoys the rest of your day, and please stay safe and take care. Thank you so much.